Nobody wants to look old, and if you don't want plastic surgery that we're getting away from, and if you're afraid of the Botox, so you don't want any of that, come and see Karen, because she's going to use ultrasonic to keep the cells young and healthy. We want healthy cells as we get older. Ultrasonic is the 21st century. So it will gently exfoliate, and we can finally say deep pore clean, because it's ultrasonic waves, and they don't penetrate, so it's not electricity. So the ultrasonic waves, when it hits water, spins, and that spinning gently exfoliates. So we've sort of gone beyond microdermabrasion. And inflammation is the enemy. Heart disease, inflammation. Arthritis, inflammation. Rosacea, inflammation. And inflammation speeds up the aging process. So by having an ultrasonic, you're getting rid of all the topical bacteria, which is a good thing. Also cleaning out those pores, because as the water is spinning, it's also collapsing. It's compression and decompression. And if anybody's got an oily skin or a lot of blackheads and whiteheads, you can see them come right out. It's amazing. It's 4,000% better than any other way. We're really getting it into the stratum corneum, which is your outer layer. That's where you want to have the water, because if you have enough hydration, fine lines and wrinkles won't etch deeper, which I'd known this 30 years ago, but we didn't. But thank God for the machine, because it's been a catch-up game. I actually have one in my bathroom.
Oh,
I know. Huh?
they make a smaller unit.
No. Well,
oh,
yeah, there's a little smaller unit than that, yeah. So the two hydrators, sodium PCA and hyaluronic acid, did nothing but attract moisture to the skin. Got to have the water.
Got it.
After that, the next step would be antioxidants. You have to fight free radical damage. And the only vitamin the body does not produce is vitamin C, the most important vitamin that we know of. And vitamin C basically is a natural skin lightener. It will protect her husband, vitamin E, from that awful woman, the hussy, called the free radical. Because every day the body makes free radicals, and she's looking for a partner. So if you ingest enough vitamin C, what he said, it will fight the aging process and fight any damage that's going to happen. And also for skin care, it will keep the skin hydrated. It works along with your sodium PCA. Also, it's a skin lightener, and it also will stimulate collagen and elastin. It has a big job, vitamin C. But as we have learned, not all vitamin C is created equal. What you're looking for in any product is L-ascorbic, has to be stable, because vitamin C is not a stable vitamin, and it has to be between 10 and 20%. And I hate to tell you what products I have used in the past before I knew that piece of information. An ultrasonic in the beginning at least once a week. And the reason for that is you're trying to get the cells rehydrated, you're trying to feed them, so when they do their cellular turnover, which as we get older takes longer and longer, up comes stronger, healthier, more hydrated cells. She has the argireline peel, which is a combination of arginine and lactic acid. And it doesn't burn, and it's not going to make her peel, so you can have it done once a week. And with your ultrasonic treatments, I would suggest it, because the difference is like night and day. Now that we have more science, and we're trying to get the blood supply, the oxygen and the nutrients into all the cells. 17,500,000 cells per square inch of skin. And they all want a long drink of water and something to eat. And then, of course, the most important one, of course, is the mitochondria. And I think all of you, if you're into diet and nutrition, I call that the furnace of the cell. And all furnaces need fuel. So the last part, besides circulation, is helping to stimulate the mitochondria. Very important. And also, we're now studying the telomeres, because in the middle of the cell is your DNA, okay? And with the chromosomes, and that's why I'm saying you cannot injure those cells, because they then open up to try to correct what went wrong. And every time they do that, those little telomeres at the very end. Yeah, the products that Karen is using, and that's one of the reasons why I like them. They have a very small molecular structure, so they really penetrate. They get to where they need to go.
Hydration, the spray, the hydration serum, And then we go into the products to help the elastin and collagen. And then there's a youth serum. And then after that, I put on the moisturizers